Sure, I can start with our introduction. So welcome again, everyone. My name is Rebecca Mant. I'm the Virtual Events Director for Engineers and Scientists Acting Locally, or ESAL. So before we get started today, I just wanted to quickly introduce our organization and talk a little bit about our mission. So ESAL, the mission of ESAL is really to inform and empower people with backgrounds in STEM to get more engaged with their local governments and their local communities. We're a 501c3 nonprofit. And I'll go ahead and put our website in the chat. I would encourage you to check it out. We have a lot of different resources, including step-by-step guides with our local engagement playbook, how to engage with your local government. And we also hold a bunch of events just like this one as part of our effort to help people with STEM backgrounds understand the different ways that they can engage with local government, and in this case specifically around the COVID-19 response. So we're super excited for this event. I think it's good. It promises to be super exciting with the panelists that we have lined up. And I also want to pitch, which I'll put in the chat, another ESAL event that is coming up next month that's actually around how you can effectively communicate with your friends and family about COVID-19. So a related event that a lot of people on the call might also be interested in. And I'd also like to introduce Jared, who was really the person who put together this entire event and reached out to the panelists. So Dr. Jared Monchen is a researcher at the RAND Corporation. His work focuses on helping city leaders address social and technological challenges. He's worked with stakeholders from cities across the country, ranging from Los Angeles, California to Caldwell. He earned his PhD in chemistry from Penn State University in 2018, studying materials for the transforming of water into fuels. So with that, Jared, take it away.
Excellent. Thanks so much, Rebecca, for that. And I think most importantly, I'm a volunteer with ESAL, which has been a lot of fun. So thanks everyone for joining us for today. And as we all know, COVID has affected all aspects of the socioeconomic well-being of cities and their residents. And cities have been really the focal points of the COVID response, and all types of scientists have used their skills, knowledge, and expertise to pitch in. And ESAL is really excited for this opportunity to share the experience of 3 individuals from 3 really different cities located across the United States. 2 of our panelists are government employees who will talk from the government perspective about how local scientists have been engaged in response efforts, while the 3rd panelist is a scientist who has engaged her local government as a volunteer, and so she'll speak from that perspective. So our 3 panelists are Chelsea Wilson, Kate Bender, and Kira Freiling. Chelsea is the communications specialist at the mayor's office for the city of Caldwell, Idaho. In addition to directing communications for the city, she works with regional partners on issues important to city residents, such as transportation, education, and food access. Kate is the deputy performance officer with Data KC, a division of the city manager's office in Kansas City, Missouri, which she helped form in 2009. Data KC works to improve the efficiency and effectiveness of city services by supporting data-driven decision-making. Our 3rd panelist is Kira Freiling. Kira is a lab manager and research technician at the Harvard T.H. Chan School of Public Health. Over the past year, she's engaged as a volunteer with Academic Public Health Volunteer Corps, a program of the Massachusetts Academic Health Department. Her work focuses on public education on COVID transmission prevention. Thank you for all 3 of you for joining us today. So I have a set of questions that I want to walk our panelists through, and then we're going to leave about 15 to 20 minutes open for questions from the audience. So please feel free to add your questions into the chat window in the bottom right of your screen. So we're going to work our way from west to east across the United States. So we'll start with Chelsea. So Chelsea, if you don't mind telling us a little bit more about your role in Caldwell, a little bit about how COVID has impacted Caldwell and the surrounding area, and then tell us 2 or 3 interesting things about Caldwell that, at least in the before times, would make us want to jump on an airplane and go visit Caldwell.
Sure. Thanks, Jared. Hi, everybody. So as Jared kind of mentioned, I do a lot of regional work with local organizations, and I serve on different commissions and boards with other organizations around the area to address issues that are important to the community, like food access. I also handle the city's social media and website. We're a smaller city, 60,000 people. So I am a department of one. And I also act as the city's lobbyist during the Idaho legislative session, which is happening right now. It's January to March every year. And I work with legislators on hot topics like property tax. Okay, and then, I'm sorry, 2 interesting things about the city. What else was I supposed to do?
Yeah, so 2 interesting things that would make us want to jump on an airplane and go visit Caldwell if COVID wasn't a thing. And it was easy to go visit Boise, which I know was actually really hard to get to by airplane.
Right, okay. So one interesting thing is that Caldwell has worked really hard on their revitalizing their downtown over the last few years. So we have a plaza, which in the winter boasts Idaho's only ice skating ribbon, which is actually a really fun time if you've never been on an ice skating ribbon. And then we are also the gateway to Idaho's, it's like Idaho's Napa Valley. It's called the Sunny Slope Wine Trail region, and there is a plethora of wineries and vineyards, and it's a really nice way to spend an afternoon.
Very good. Thanks so much, Chelsea. So our next stop will be Kate in Kansas City. So Kate, just to quickly repeat, you're a little bit more on your role in Kansas City, a little bit about how COVID has impacted Kansas City, and then 2 interesting things about the city.
So as Jared said, I'm over the office called Data KC, which is part of the city manager's office in Kansas City. So Kansas City is called a council manager form of government. So we have a central administrator who's hired, and then along with our mayor and city council. So our office has been around for about, I guess, 11 years, and we've sort of been consistently focused on how to use data to improve city services. And it's really been kind of a burgeoning movement across municipal governments in the US. There's been a lot of strong support from organizations like Bloomberg Philanthropies and Results for America and lots of others. So it's been a fun time to both for myself to learn more about trends in data and figure out ways to integrate them. And I'm sure I'll talk more about the types of things we do as we get into the conversation. But COVID has obviously impacted our city, just as, we've kind of had the both Midwestern experience of having a big wave this fall that hasn't really, that we're still very high, just starting to decline. We have a pretty big suburban surrounding community in 2 states. We also have a little bit of politicization of the issue with 2 red states and kind of a blue community. And so we've actually had to really deal with the issue of moderating our policy directives with COVID so that they are not too far afield from our surrounding suburban communities, because this is a disease that, if one community has bars that are closing at 8 and another has bars that are closing at midnight, the one, the directive to close at 8 is not really going to be all that impactful. So, and then in terms of things about the city, maybe things that you're very well aware of, but I can't not mention our AFC Championship Chiefs. 2nd year in a row, 3rd year hosting and going to the Super Bowl. And so that has been, I would not kid you in saying, like, I think that the Chiefs are maybe like a quarter of the reason that Kansas Cityans are waking up like this fall and winter, because it is really keeping us together. But and a fun kind of probably pseudoscience fact about that, I saw an article early last year after the pandemic started that, there was kind of a meta-analysis of if the 49ers had won the Super Bowl last year, it might have actually led to a bigger uptick of COVID because they would have hosted a parade. We hosted a big parade, but the disease hadn't really made its way to the Midwest at that point. So it wasn't really in danger of being a super spreader in the way that it might have been on the West Coast. So we'll take credit for that, as well as the Chiefs win. beyond, sports. We have really well known for barbecue and actually great food in general. Also have a really revitalized downtown with a streetcar that runs for free throughout that we're extending. Also well known for jazz and other culture. So yeah, post-pandemic, hope to get back to all that.
Excellent. Thanks so much, Kate. Kira, over to you in Boston. A little bit more about your role in the city, a little bit about how COVID has impacted Boston, and then tell us a few things that make us all want to jump on a plane and visit the city.
Sure, absolutely. Thank you, Jared. So I do not work in Boston government. I'm on the opposite side of the topic of this panel discussion, in that I am a lab manager and research assistant at the Harvard T.H. Chan School of Public Health. And while I primarily do work in infectious disease, I study primarily antibiotic resistance in Neisseria gonorrhoeae, which is the primary agent, causative agent of the STI gonorrhea. So a very different world from what I've been introduced to now through my work with local Boston government. Some interesting things about Boston are, since it's a city of great firsts, some of my favorite firsts are that it has the country's first public park, which is Boston Common and Boston Public Gardens, which are a beautiful center of the city. And my personal favorites are all the food firsts, which is that Boston had the first chocolate factory in the United States and was the region in which the chocolate chip cookie was invented. So thinking a little more about COVID, Boston has certainly not been excluded from any impact the rest of the country has faced, from having one of the first major super spreader events pretty early on in the pandemic, to having some of the region's largest hospitals hit pretty hard and had to adapt some of their policies, and challenges with the coming and going waves of the pandemic, but also a lot of successes in terms of being a hub for vaccine development, and a lot of other pharmaceutical successes in this area.
Very good. Thanks so much for that. So I want to move on and talk a little bit about how scientists have engaged local government. So we'll start off with the local government perspective with Chelsea and Kate, and we'll start in Caldwell again to move West Coast to East Coast. So Chelsea, tell us a little bit about how both professional scientists or scientists that are directly affiliated with the local government, like what we talked about with scientists in the Public Works Department, and then maybe non-government affiliated scientists that maybe work at Boise State University and surrounding colleges, as well as other volunteers, and how they've interacted with the local government.
Sure. So I guess I'll start off with scientists that work directly in the local government. So we have our Public Works Department, and they are a team of scientists and engineers. They run things like the wastewater treatment plant. And then we have the city engineers, and they do more civil engineering projects like streets. So one interesting thing that happened with the beginning of COVID was when the toilet paper shortage occurred, there was a lot of people that were flushing non-flushables down the toilet. And this actually resulted in kind of a crisis at the wastewater treatment plant in backups, and it caused all kinds of, overtime for the wastewater treatment plant employees. So that was actually something that trickled down to me. Even in my communications role, I had to put out notices about, please don't flush non-flushables. So they had to come up with some creative solutions, I think, at the plant to fix that issue. Another thing, as far as engineering, how engineers have addressed the pandemic, was it's actually probably been a good thing for our roadways, because there's been less commuter vehicles, and we've actually probably preserved the life of our roadways. And the city, we have our own engineers, but we also work with regional planning entities like the Idaho Transportation Department, and we also have something in Idaho called highway districts, and they have their own teams that do different highway plannings. So that has been another way that scientists have engaged. And then also there's been indirect engagement, right? So there's been a lot of, I think, creative ways to sanitize surfaces that have come out, or maybe they have already been in place and cities are just now, getting hold of them. But the city ended up buying UV lights to sanitize different offices. And then we have also reached out and worked with scientists. So that's how I met Jared, actually, was we were working on a transportation project together along with somebody at the University of, of Boise State University. And yeah, so there's been a lot of direct and indirect engagement. A lot of the direct engagement does come from city employees, and then indirect is, things that scientists do that they develop and then we use as a city.
Perfect. Thanks. Kate, how about you in Kansas City? Tell us a little bit about how scientists have been engaging the Kansas City government on COVID-related relief.
Yeah, so one area that our office spends a lot of time on, but we work with actually an outside contractor, is we do a resident survey every quarter. That it's a random sample survey, so large sample, high response rate. And so we use that data really to track resident perceptions with city services, with quality of life, and also look at disparities across income groups, across racial groups, across geographies. So it's one of our most important kind of set of metrics, and we really kind of try to integrate it into both operations and strategic efforts. Excuse me. So when COVID kind of just appeared, like burst into the scene, so to speak, our contractor actually kind of jumped right on that. They work with a lot of cities, and they reached out and they said, would you be interested in having the results of a smaller but still focused random sample survey of Kansas City residents about perceptions of COVID? And I was like, absolutely, yes. Especially since they were offering to do it as a service to us, since we were a long-term customer. We ended up repeating that survey 4 times from March to late June, early July. And with the second survey, we started integrating some of our own questions in as well. And it was really invaluable because it was a time where there was plenty of, I would say, national polling about, perceptions as it evolves, but, inferring that to your local community is really difficult. Also, just the way things were moving so quickly in a lot of ways, that tracking the progression of not just, cases and things that we could really track in that regard, but what people thought, how people were feeling, whether they thought that the pandemic was a threat, what they were doing in response to it. So, through that survey, we were able to see that, before our mask mandate, which was, still masks were being recommended, but we didn't mandate them until July. Before that, 78% of our residents said that they were wearing masks. Post mask mandate, 91%. So that was a really nice, concrete element that we could take out and share, along with insights about, financial impact, mental health, and other issues. We also partnered with an outside organization called Behavioral Insights. That is a group that started out of England that does, they were known as the Nudge Unit, if you're familiar with that whole field of work. And they have focused their efforts on random control trials, and evaluations, especially in the government sphere. And so we actually tested some mask messaging in partnership with our communications group, so different images, and then surveyed the people who saw them to evaluate the relative impact of them. And that gave our communications group a good sense of where they should focus in terms of masks. One final thing I'll mention is, I think as I look back on the year, and we put together an annual report that details a lot of the COVID projects we worked on, I think it very well could have been a year where things like data kind of went out the window, because it's like, whoa, we got to get back to basics, or we've got too many things going on, we don't have time for this. But I felt, looking back on the year, that in fact the opposite sort of happened, that everyone leaned in more to the sort of things that we had put in place with regard to data, supporting local government efforts. And one area where we really saw that was the rise of the dashboard. People have been using dashboards for years, but like no one has ever used a dashboard as much as they have this year. And so our office was involved with that, working with health, working with others to rebuild our COVID dashboard for the city. And so that was a really interesting process of it's something that we've done in the past, build data visualizations on different topics. But I think the stakes felt so much higher in doing this type of data visualization because a lot of people are really closely tracking this. And so trying to decide, what should we be elevating? What should we be focusing on? Is this data clear cut enough? And so it's really been a pretty evolving thing. I've done a couple iterations just even since the beginning of this calendar year. But it's also been really gratifying to, deliver data in a way where I know it's really being used by our community.
Mm-hmm. Yeah, absolutely. I know that's something that we've also had a lot of conversations about, is how to better make the data better, the sources more user-friendly and better incorporate it in local decision making. So absolutely, thanks so much for that perspective. Now, Kira, I know you're going to have a slightly different perspective on this. So maybe from your perspective as a volunteer and as a local scientist, tell us about some of the different options that you had for volunteering in your local community, and perhaps why you picked the specific route you did, and then how you found that avenue.
Absolutely. So as you mentioned at the beginning, along with my work, I volunteer with a program called the Academic Public Health Volunteers Corps, which was formed as a program under the Mass Department of Health at the beginning of March in response to the COVID-19 pandemic. Broadly, this organization serves to connect Massachusetts public health current students, alum, and staff with local public health departments across the state in order to help support them in addressing local community needs. A lot of this is focused primarily on contact tracing, general communications, and also the promotion of health equity. And so for me, kind of primarily at the beginning of March, when I felt like things were ramping up and could see how my community was being negatively impacted by COVID, I think I felt, as I know a lot of my peers did, kind of powerless in the whole situation. And I had a background in infectious disease and an understanding of public health research, but not a good way through my work directly to support my community. And so I started to think about ways that I could apply my skills to whatever needs my community had at the time. And so I was looking through different resources that the graduate school that I work for had posted, and began talking to my peers a lot about how we could work together or individually to identify needs in our community. And I was able to be connected through contacting this organization kind of through cold email, by looking through the Massachusetts Department of Health website. From there, I kind of submitted myself as an open book saying, I have this background in public health research. I'm really interested in learning more about how we can take a lot of kind of overwhelming scientific information and make it more accessible for the community, because I had seen that that's what felt like a lot of disconnect for myself and other community members. And I was connected with the Holyoke, Massachusetts local public health board, and requested that, they were really looking for someone who could kind of condense and make more clear a lot of the rapidly changing Massachusetts guidelines on COVID. And so the work that I do is primarily focused on health and COVID policy communication. This looks a lot like pamphlets or infographics and talking points for community members. And so a lot of this outreach is focused specifically on business owners and worship centers, which are some of the largest gathering areas in this community. So with this, it's important to make sure that these places are really distributing information as local talking points for community members. And so a lot of the things that we do is translational work with communicating simple guidelines, or I guess more mandatory guidelines like indoor gathering capacities and mask mandates, but also providing suggestions for non-mandated activities, such as ways businesses can adopt new policies to help slow local spread, while still maintaining their vibrant community connection and keeping their communities safe. This has been a really interesting and rewarding experience for me. I don't have a background in government work, and so kind of getting the inner eye to see how different needs are prioritized and really how much people care and how much people want to be involved and learn new information has been really valuable.
And that's a really powerful sentiment that we could all relate to. And you brought up a couple of really interesting points that I want to dive into a little bit deeper with the broader panel and focusing more on health and policy communication. So Chelsea, in your role as the communications director in Caldwell, have you leveraged in any way sort of the skills and knowledge of local scientists, or have you been able to tap into anyone as you've been sort of deploying your communications materials, and especially sort of understanding that Idaho is a particularly complex stakeholder ecosystem, I think, when it comes to mask mandates and some other government requirements?
Sure, you are definitely correct, Jared. Idaho has a very interesting kind of hot and cold attitude towards COVID and mask mandates, with the blue area being more amenable to those sort of orders and suggestions, and then the surrounding red area, which Caldwell is a part of, less so. So yes, we have worked with scientists. Idaho is split into different health districts, and each health district advises and serves a certain area. So our health district has been, you could probably imagine, pretty overrun during this time, but we have worked with them. I have weekly meetings with their communications team, and they share their materials with us, things that Kira mentioned, like pamphlets and flyers and things like that, and then I distribute those to the community through our communication channels. That being said, if a local scientist had come to me, or a university scientist, and said, hey, I think I can help, I think I can probably break this down for the community and make it easy for them to understand, I would have said, oh my gosh, thank you. That'd be fantastic. So yes, we have definitely worked with local scientists, but I think that more is always better.
Very cool. How about you, Kate? I see you nodding.
Yeah, I think as you both were talking, I was just thinking about how I think there's a tendency sometimes, or maybe pre-pandemic, like I would have thought about sometimes things like science can come into conflict with, or there's tension between, sort of government policy, or there's some sort of, well, here's what we should do, from a pure scientific perspective, but now we have to filter it through this messy government apparatus, and then we're going to end up with something lesser, that kind of concept. But I think watching all this unfolding through the COVID pandemic has made me a lot more conscious of how much more of a actual melding of perspectives it is, and how important they both are to the outcomes. So I would say, we are unique compared to a lot of cities, that we have our own health department. That's largely a county function in many areas. And we do have one in the surrounding county as well, but we have our own city health department. So I think in some ways, I know that's been a frustration in other even bigger cities than Kansas City, that they didn't feel like they had as much control or ownership over a lot of the kind of staffing functions to support COVID. But so we had, our health department director, who is, public health expert. We have our head of our emergency medicine, our director of our emergency medical system, who's a EMS physician and also oversees the system. The two of them have really been the head of the sort of science and that side of things in terms of the pandemic, and providing the public health perspective, and then the sort of emergency medical, physician's perspective. And so it's always felt like that was just a really strong foundation for that information. At the same time, as I mentioned, initially during the shutdown, we had a lot of unity across communities, across governments. As things started to evolve after the shutdown, we had some of our surrounding communities, including really big local governments, some of our biggest counties, say, well, we're not as interested in doing something that strong. And I think my prior perception would have been, again, like, oh, this is public health or science kind of kowtowing, the politicians are kind of winning. But actually, it was a much more subtle thing where, we actually had pretty strong support from the local population for a lot of the government directives. And I think there was definitely a sense of, on the margin, some of these marginal issues, we are better off, not having quite as strong of a mandate or a rule, but maintaining that support, as opposed to pushing harder, being an outlier among our surrounding communities, and also like taking a portion of people and pushing them to being opponents and maybe making them less likely to adhere to the other basic things. So that balancing act to me, and the ability for scientists to speak government and government to, understand the science, I think is a lot more complex, and I appreciated it a lot more to see how those different things kind of interplayed.
Yeah, I think that's really interesting. And just to dive something into a little bit more into that, since you're both, I think, talking a lot about the successes that scientists had in pushing across communication materials that you could then rapidly use, but as an academically trained scientist, that's not something we're trained to do. And I have a whole list of pretty significant fails that I could point back to, like, that was not a good strategy that I had pursued and I didn't win anyone over. So I'm wondering if you could talk a little bit about that and maybe some of the strategies that you've seen scientists pursue that weren't ideal or weren't the best way to move forward, and then potentially some recommendations for reshifting an engagement strategy.
I can go first. I think, not to sound critical, but I think a lot of times scientists
Sound critical.
Yeah, I think they engage at a level up here that the general public doesn't understand and can't keep up with. I actually have this problem with our public works director. I have to ask him to slow down. Layman's terms, please. So I think knowing your audience is really important. You may be, bringing something that would truly be valuable to the table, but if you're not conveying it in a way that the local government or whoever you're working with can understand, it's not going to be successful.
Very good. Okay, so nodding along.
Yeah, definitely. I mean, I think that the filtering through communications, I mean, I mentioned sort of the positive side of this, but I mean, in case you missed it, when I talked about dashboards, I think we're on our 4th iteration. And that was largely because just the speed at which these things had to be spun up and the lack of resources to dedicate to them. And so over time, but it's also because, yeah, I mean, I think on the communication side, I've talked to lots of other local government officials who feel this way, that first of all, our public health systems are totally overwhelmed. And a lot of even if they have communications professionals embedded in them, they are handling media requests and news stories and the things that are on fire, as opposed to being able to sit back and say, strategically, how should we be laying things out? And so I think I've seen some benefit, like our COVID web page has sort of like expanded and contracted and gone in lots of different directions as we've tried to filter in not just like what we think you need to know, but or what the scientists and public health things you need to know, but what people want to know. And bringing in communications professionals who maybe have less of the science perspective and are focused more on the customer, hearing the customer. And we actually did a little survey on that too, just to ask people their experience in looking at our COVID webpage and tried to integrate that. But it's a hard thing to balance, especially, like I said, when you're constantly dealing with emergencies.
Yeah, without a doubt. I can definitely attest to all of that. And Kira, I want to hear from you, but before I turn it over, I just want to remind attendees to please feel free to enter questions into the chat box. And that way, this event is for you all to learn about how you can better engage local government. So please feel free to enter any questions that you want our brilliant panelists to answer. So Kira, you've heard from our local government officials about some of the challenges from their perspective for engaging local government, from scientists engaging local government. What challenges have you experienced as the scientist? And then how have you adjusted your strategy?
Absolutely, Jared. That's a great question. And listening to Chelsea and Kate's responses, it's interesting to hear because I feel like a lot of the same challenges that they have engaging scientists are challenges that scientists experience engaging with government officials. Speaking for myself personally, I think one of the biggest challenges I faced exactly was trying to get from the big scale information down to something that was a little more digestible. I think on a day-to-day basis, I actually spend more time editing the information that I write and really trying to get into a level that's accessible for all community members and also easily translatable is a lot more work than, for me personally, just taking all the information that's out there. I think another challenge that I faced with that is being open-minded about focusing on a variety of problems. I know a lot of people in the scientific community have things that they're very knowledgeable about and want to use that specific knowledge to help in some way. And I think one of the greatest lessons I've learned doing this work is being open-minded and flexible in terms of not using the knowledge that I have, but the skills that I have. And coming forward with these skills, being like, this is what I have to bring to the table. This is what I can offer. What is the best way that I can engage with you to use those skills rather than what is the best way to engage to use the knowledge that I have. And I found that that's been, it makes it a lot easier for me to communicate with the government officials that I correspond with. And it kind of clears up a lot of channels of confusion that I found at the beginning that was like, okay, I know X, Y, and Z things, and you know X, Y, and Z things, but we're not talking about the same things right now. I know that I should be focusing on the things that you're thinking about. So how can I make that more accessible to you, if that makes sense? So it's very reassuring to hear from Chelsea and Kate say that they're thinking about how can we really make sure that scientists are being engaged that is tailored to specific needs rather than just thinking about general knowledge.
Very good. I really like that. And I think you've talked about this a little bit, but when you talk with your peers at the university or other scientists that ask you how to get more involved, what do you think is the first step or the first few steps that they could take to get more involved in their local government?
So I think the first step, and this is kind of an obvious one, is to take the thought that you want to get involved and actually do something about it. I think that when you're sitting at home, as a lot of us were in March and April, kind of just facing the whole of the internet and maybe not sure how to build the right connections, it can be a little overwhelming to reach out to your local government, no matter how large it can be. But I would encourage people at this level and scientists above me to think about really presenting, as I said before, your skills rather than your knowledge. And like those skills do translate really well into government work, even if you're intimidated about that. And so for me, I think that was the biggest hurdle to get through, was that, okay, I can actually be involved with this rather than just kind of sitting at home and being like, oh, well, I don't know enough, or I'm not involved in government work, so I can't really make that jump. From there, I think the best places to look are starting off on your Department of Health website if you can. I've found that our local government agencies have really wanted people to be engaged and help, and have tried to make those resources available. And so even through like a simple Google, sending 15-30 minutes on your Department of Health website, trying to understand what the greatest needs are and how you can meet those. I think I originally got involved with this organization through word of mouth as well. So not only looking on websites, but staying connected with the people that you work with, asking if other people are looking into opportunities and what they've been learning about, or if they know anyone who is looking for help. So I think a combination of off the bat, just recognizing that you can be engaged and getting over that hurdle. And from there, being open-minded about what different opportunities could look like and reaching out about them.
Yeah, thanks for that. I think I totally agree with that. There's definitely a perception of a really large activation energy barrier to engaging at any level of government. But I think at the end of the day, it's just kind of just doing it, right? It's just opening up the laptop and sending that email and seeing where it goes.
Very much so. As people always say, the worst that you could hear is nothing or no. And, I think that that's very much so not the attitude now, especially over the course of the pandemic, and approaching it more as what skills I can provide makes all the difference.
Very good. Chelsea, you were really enthusiastic about local scientists engaging you and helping at least the Caldwell government. What would be some words of advice that you would offer to individuals who may be hesitant or not know how they could contact you and your colleagues in the city government?
Sure. So I think probably one of the most important skills you can have is relationship building. So for instance, our public works department and engineering department they're scientists and engineers, and they are part of the same community, that you're part of, and they like to hear from you. I actually, for this webinar, I asked our public works director if he would be receptive to other scientists reaching out and, just asking to have coffee or a virtual Zoom meeting or whatever, and just talk about ideas and problems. And he said, absolutely, that never happens. But, they would be happy to have it happen. I do want to advise against, one way to engage in local government that we actually encourage most people to do is you can go directly to a city council meeting and give some sort of a presentation. I think for scientific purposes, it's probably better to start relationship building with the other scientists already in local government, and then to gain trust that way. And then that way, if you have an idea and you want the city to implement it, it's going to be the city council members and mayor are going to be more receptive to hear from their employees that they trust and that they appointed. So I definitely think relationship building is probably number one. As Kira said, just send the email. They're busy people. They might not get back to you right away, but I think at least in Caldwell and at this level of government, kind of the medium city size, a lot of them would be very receptive.
Yeah, I can definitely relate to just send email. Remember when I was in graduate school, I was running a 36-hour-long experiment at Argonne National Lab at the synchrotron, and at 3 a.m. sent a delirious email to my local government official, and it turned into a monthly breakfast meeting where we could just connect and talk and just chat about some of the local challenges that the government was experiencing and how I could help. So definitely agree with that. Kate, what do you think? Are any words of advice for how local scientists could engage you and the rest of the government, the rest of the city government?
I agree with everything that's been said, and I think relationship building is really key. A couple of tools or mechanisms. One that's very low impact and not going to be super effective on its own, but I think is a good entry point, is getting engaged in social media around your government. I think it's a good way to sort of track where your interests might be or who those people might be, right? Even in a city, Kansas City has about 500,000 people. It's a metro area of 2 million. So, not tiny, but, I can name probably 15 or 20 people who I've come to sort of track on Twitter who are not part of the government, but they have some sort of professional interest, and a lot of them have specific skills, and they're weighing in a really interesting and knowledgeable way. And it's, again, for that to really be effective, it needs to move outside social media too. But I think that can be sort of like you said, your email that triggered a breakfast. I think I've seen some of those people go on to become parts of boards and commissions, write up email newsletters, build relationships with people off of what just started off being some chatter back and forth on Twitter about a specific, but I also think it's a way to sort of educate yourself of some key issues or topics that are of interest. I would, speaking of boards and commissions, that's probably not the same in all cities, but I think that's an amazing way to engage. Kansas City has tons of boards and commissions, and a lot of them, like Kyra was saying, the skill sets, I think, that scientists are bringing a lot of times, which is sort of an evaluative process-minded approach to things, are super helpful in a board and commission setting, just to have someone at the table who can drive the conversation forward in that way and is interested in that type of So I think that can be a really transformative way to make an impact. And then a final like sort of resource and opportunity that's pretty basic is I think universities are one of the main connection points with local government that is a little more formalized. And you know, even if you yourself aren't affiliated with a university, I think that maybe could be a less or lower impact or less scary way to engage with a department there that might be working on a project. So I've had a lot of relationships that started with a really specific project or department, but have morphed forward to being a relationship with the person, you know, and we've moved forward and done other projects together.
Very good. And I'm really happy that you brought up boards and commissions. So the ESAL has a playbook guide available online at our website at esal.us. And the link to the specific guide on how to join boards and commissions is available in the chat. So please feel free to open up that link to learn how you can go ahead and follow that pathway that Kate had suggested. So Kira, I want to turn to you, but again, I want to encourage anyone who's participating in the event to please leave questions for our panelists in the chat so I could stop talking for a little bit. But Kira, I'm curious if your experience volunteering with the government during COVID response has perhaps changed your future outlook on engaging local government, if you're now thinking about getting more engaged as a result of your experience, and if so, how you're thinking about doing that.
Absolutely. So something that Kate said before, or excuse me if it was Chelsea, that really stuck out to me was the idea that I think prior to this engagement, I had a very kind of black and white view of what scientific engagement in government looked like. And that view was mainly comprised of the idea that, you know, there's kind of not a good melding of information or not a good melding of communication between the two, either just because there's like the scientific community is very rooted in what they believe in, and it's hard to have that communication to the government level and vice versa. And I think now that I've seen that I think this pandemic has facilitated, but also it existed previously, there is a desire for engagement between the two, and it's very important to do so. And, you know, prior to this, and something that motivated me to get involved is my interest in doing something or taking my career in a direction that's a little more public engagement or government policy focused. That's always been an interest of mine, especially in the realm of infectious disease. And I think that this engagement has really only cemented that for me by showing me that it is actually very productive to have that kind of communication, and that there are a lot of different ways that you can be productive, if that's through having a scientific background and then transitioning to a government position and using your expertise that way, or staying within the scientific community more generally and engaging either in kind of more regular communications like you spoke about, Jared, during your graduate school experience, or through volunteer experience that you do supplementary to what you consider your more traditional work. It's definitely encouraged me to make sure that that's a forefront no matter which path I decide to take. And it's something that's a lot more accessible than I had previously believed that it was, and that it's much more possible to have a balance of public policy communication and hard science research. I also wanted to add one of Kate's points that as a scientist, Twitter is also a great location to learn more about not only what issues are currently pertinent to your public health government as a whole, but also who specifically within that institution is interested in those ideas. It can be kind of intimidating to have just kind of like a general inquiry or board email to research, but if you can get in touch with someone who is more specifically interested in the ideas you are, it's quite helpful. And there's also a wide variety of volunteer postings and jobs that are made available through Twitter that you can find.
Awesome, thanks for that. So if you could quickly also, one of our attendees asked about some specific risks of scientists engaging. I'm not sure what type of risks that individual is specifically asking about, whether it's professionally or personally, or perhaps the rate of information change being so fast. So if you could talk a little bit about to those risks and what are some good mitigation strategies. But before you do that, Chelsea, I just want to give a heads up. I'm going to turn to you because there was one specific scientist that we've talked about in some of our previous conversations, the public health official in Boise, who had a run-in with a local militia. So I want to turn to you after Kira goes ahead and answers.
I can't pinpoint any specific risks that have come up. I think maybe that could be because I have been doing this as like a volunteer position exclusively. So I've tried to be very intentional about how I coordinate this along with my work as a whole. I think in terms of mitigation of any potential risks that may come from it, just making sure that as a scientist, you are really staying in line with the message that your local government is trying to send, viewing yourself more as a communicator for them, and just making sure that you are really like reminding yourself and checking in about what the needs are at that time. I know that a lot of people in the scientific community can feel very passionate about certain topics. And I think as with anything, when you're speaking to members of the public or writing public communications, really make sure that you're circling back to the original message of what you're trying to communicate is really important. And I think just having like regular check-ins about that and making sure regular check-ins with both, I guess, yourself and with the government official that you're working with is very valuable. But if you have any more specific concerns or risks that the person who asked this question is interested in, I'm happy to hear and speak to that.
And so I want to turn to Chelsea because while acknowledging that the example that I'm hoping she's going to talk about is pretty on the extreme of what could happen when a scientist engaged, I just want to make sure that that there's awareness of that this risk exists. So Chelsea, maybe in about 2 or 3 minutes, could you talk about the situation that with the local county health official and the militia?
Sure. So as I mentioned earlier, Caldwell Health is kind of governed, for lack of a better word, by local health districts. And there was a county commissioner that was sitting on one of these local health districts, and they have public hearings, and they were having a vote on whether or not to implement a mask mandate. She's not a scientist, but there was a large protest against the mask mandate, and some of the protesters went to her home where her young son was home alone, and I guess it was reported that they were like flashing firearms and banging on her door, and so the meeting had to end pretty abruptly because of it. So that is a pretty extreme example, and I don't want to say that that's going to happen to you. You engage in your local community. And like I said, she wasn't a scientist, but I guess it is wise to be aware of the political atmosphere in which you are engaging. And that's why I think I mentioned relationship building is probably the first avenue to go to, especially in a state with, maybe the elected officials themselves are, very pro-science, but some of their constituents may have differing opinions, differing views, and that's ultimately who they answer to. So it is important to kind of band together with those other scientists that they trust and approach situations from a collaborative viewpoint. In not every situation is necessary to do that, but in something that's sort of more politicized, like the pandemic has been.
Very good. So I want to go around for any last thoughts. So Kate, we'll start with you. Any last takeaways that you want our attendees to take home with them from today's event?
I'm just thrilled that an organization like ESAL exists and that there are people who are engaged in it and looking at that there are people who were interested enough to seek out these resources, that it's been enough to support a community. Because I think on the whole, local government is sometimes like the stepchild of government in the US, that it gets not nearly the amount of attention as federal government and the state government, but so many of the things it deals with are the things that impact people day to day. And I'm constantly, even in moments where you know, having big backlash to something, or people being negative, or there's a huge Twitter thread, or people aren't understanding something, I still am always pushing for more engagement and more informed engagement, because it's lacking on the whole. There's a lot of people who just kind of go by consider themselves engaged in government, but don't do anything with regard to their local government. So I think all the tips that have been given, I think there's so many different ways to engage, but I definitely think that the scientific kind of mindset and approach and attitude is so needed, and there's a lot of opportunity to integrate it into government.
Very good. Kira, what do you think? Any last takeaways that you want attendees to take home with them?
I think from my perspective as well, Kate pretty well hit the nail on the head, that there are so many great organizations and ways to get involved, and that it doesn't have to be kind of a scientific community and government community separation. And that, you know, the biggest step is just making the decision that you want to do that, and that you can be open-minded and flexible and just put yourself out there in a way that you maybe didn't think was possible before, and just being open-minded to applying your skills in a new setting, and searching out opportunities through organizations like ESAL.
Very good. Chelsea, over to you for the last word.
Okay, I just want to say that I am thrilled an organization like this exists. Local governments are always looking for more engagement. I mean, it's obvious just in the amount of voter turnout that most local elections have that it's just horrible. The amount of people that engage in local government. So anyone and everyone is welcome to engage, and especially scientists. Don't be afraid to put yourself out there and start building relationships, especially with those other scientists that already are involved in local government. And we're happy to hear from you.
Awesome. I think that's a fantastic way to end today's panel event. So thank you so much, Chelsea, Kate, and Kira, for joining us. Thank you to everyone for joining us for today's webinar. Today's webinar. You can learn more about ESAL at esal.us, where you could find our playbook and other resources available. We have upcoming events that we would love for you to join in. And as you close out of Zoom, you should all receive a survey, and it would be really helpful for us as we continue to plan ESAL's event series. If you could go ahead and respond to that survey, so that we can make sure that we're delivering a series of webinars that are most impactful for you. So thank you, Chelsea. Thank you, Kate. Thank you, Kira. And thank you, everyone. And we hope you enjoy the rest of your day. Bye, everyone.